Write FDA AI responses without overpromising. SaMD English Guide. Welcome! In this micro lesson, we'll shape FDA-ready answers for AI in healthcare. Your goal is to answer the question precisely, nothing extra. Protect your claims. Only state what you can demonstrate. Regulators look for controls, data, and limits. Show how the system is governed, what evidence supports it, and where it doesn't apply. Use calm, traceable language so each statement can be tied to a document, dataset, or procedure. Think. Concise claim, referenced evidence, and clear boundaries. This approach builds credibility and reduces review friction. Start with a one-sentence answer to directly address the reviewer's question. Then provide evidence and references that support that answer. Cite reports, datasets, SOPs, and version numbers. Use numbered, short paragraphs to keep logic clear and scannable, e.g., 1. Claim, 2. Methods, 3. Results, 4. Limitations. Close with scope and next steps. Who this applies to, where it doesn't, and what additional materials you can provide. This structure respects reviewer time and makes your rationale easy to audit. Use language that accurately reflects capability and limits. For indications, say, "The device is intended to," and specify tasks and patient population. Describe AI outputs cautiously. The model estimates, rather than knows, or detects with certainty. Anchor results. Performance in our data set was, followed by metrics, confidence intervals, and sample sizes. Add a limit when needed. This does not imply to prevent overgeneralization, e.g., this does not imply clinical outcome improvement without supporting studies. Precision prevents regulatory pushback. Be explicit about the system. State model type and version control, e.g., CNN version 2.3, build date. Describe input data, features and outputs, what goes in, what signals are used, and exactly what the model returns. Outline training and validation datasets, sources, timeframes, inclusion/exclusion, labeling method, and pre-processing. Specify intended use and user population, clinical setting, operator qualifications, and patient groups. Clear definitions help reviewers map risks, verify relevance, and confirm that claims match the actual implementation. Report metrics with confidence intervals and N. For example, AUROC 0.93, 95%, CI 0.9, 0 to 0.95, N equals 2, 140. Describe datasets and bias checks, demographics, sites, devices, and methods used to assess subgroup performance. Summarize failure modes you observed and their frequency, plus how they were discovered, e.g., error analysis, retrospective review. Reference artifacts like SOPs and validation reports so every claim can be traced. The goal is reproducible evidence, not adjectives. Show the data, the method, and the limits. Explain where performance may drop. New scanners, atypical populations, rare conditions, or low-quality inputs. Present mitigations and a monitoring plan, automated data quality checks, threshold alerts, and periodic reevaluation. Keep human-in-the-loop safeguards, confirmation steps, clear UI warnings, and required clinical oversight. Detail update and rollback procedures, version gating, release criteria, and a rapid revert path if metrics degrade. This proves you can detect drift, contain risk, and sustain safe performance in real-world use. Describe your predetermined change control plan, which parameters or data you may change, and the bounds for those changes. Define data management and drift triggers, how you detect shifts and when they require action. Require verification and validation before release. Test plans, acceptance criteria, and sign-offs for each change class. Monitor post-market surveillance signals, complaints, overrides, adverse events, and real-world performance dashboards. A clear change control story reassures regulators that the product remains safe and effective as it evolves. End by restating scope and limitations, what the AI supports, not replaces, where it performs well, and where it should not be used. Offer specific follow-ups and artifacts, protocol IDs, dataset summaries, validation reports, and SOP references. Avoid future claims or marketing. No promises about upcoming features or outcomes. Use consistent terminology throughout, so claims, metrics, and documents align. A disciplined close signals control, transparency, and respect for evidence, exactly what reviewers expect.